Well, Doug Ford is further privatizing healthcare, spending $125 million in order to open up 4 new private clinics. Yes, you heard me. They are giving tax dollars to open up for-profit clinics that other people get to make money off of. And this is specifically for hip and knee replacement, which are really simple surgeries which are actually good for hospitals to have because when we get rid of them, it actually makes staffing at hospitals harder. And when done at a public hospital, it only costs about $10,000. But when done at a private clinic, it can be $28,000. And it might actually be more because the province hides these costs due to confidentiality agreements. Listen, we know that private for-profit clinics do not save taxpayers money. We also know that they do not reduce wait times. Before Doug Ford started to privatize these types of surgeries, we actually had the lowest wait times in the entire country in Ontario, with places like Quebec, Alberta, and Saskatchewan that had them privatized had the longest wait times. So we're spending more to get less. That's just Doug Ford's Ontario. And the worst thing is we actually have studies that show that the only people who benefit from the private for-profit centers are the wealthiest among us. Because when you look at patients by socio-economic status and look at their access to cataract surgeries, you find that only the wealthy have access to these clinics. Because these clinics don't want to take in poor people. They want to take in wealthy people that they can then upcharge. Because here's the fatal flaw of private healthcare. It literally cannot be cheaper because somebody needs to be making a profit. There is no world in which private healthcare is cheaper than public healthcare. It is literally impossible. Because if it was, nobody would be making a profit. But in Doug Ford's Ontario, he wants to give $125 million of your tax dollars so that other people can make money off of your health. Follow for more.